So now we're going to learn how to differentiate between the upper cervical and lower cervical, or the AO joints, the AA joints, and C2-3 when you're having somebody come in with trigeminal symptoms. So in the acute cervical scan, we've already done active motion testing and said, okay, it's safe to touch the patient. So when we get to that point, the patient's coming in, and let's say they're having right rotation, and it's reproducing retroocular pain on the right. We want to know what joints are going to be guilty or implicated in this scenario. The best way to do that, if right rotation increases the pain, is have the person side bend to the left. When they side bend to the left, that's going to cause C2-3 to rotate to the left, and the AO and AA joints to rotate to the right. So I'll side bend to the left, and I'll rotate them to the right again. If the pain increases, what that will do is that will implicate the AO joints, because left side bending causes right rotation. It's an uncoupled motion. If I side bend them to the left and then rotate to the right, and the pain decreases, that would be C2-3. So then, to confirm that, what we would do is side bend them to the right, because that would cause right rotation of C2-3, and that should increase their pain. We could continue by doing left rotation, and that would implicate the facet joints as we compress them. Or I could right rotate them, and that would implicate the joint capsule. When we've done our assessment, what we've done is we've looked at the fact that right rotation increased pain, retroocular pain, trigeminal symptoms, and then left side bending, which in the top two joints will cause right rotation, and right rotation increases pain. So we know that it's either the AO joint or the AA joint. What we're going to do is we're going to actually rotate the atlas, because the muscles skip the atlas and go to C2. Most of the suboccipital muscles and structures actually attach on the occiput and go down to C2, like we've showed you in the anatomy videos. So, if I have him rotate to the right, and I fix the occiput, and I take the atlas, and I have my thumb, so if I rotate this way, a little bit more here. So if I'm this way, and he's rotating, and then I take, so he's rotating to the right, and I take my thumb, and I'm on the back of C1, I can rotate it to the left. If I rotate him to the left, what that's going to cause is the AO joint to rotate to the right, because C1 is under the occiput. So it's like when you have a jar. You can either turn the jar one way to open it, you can turn the lid, or you can turn the bottom the other way. Joint motion is always named for what's on top. So if I'm taking the bottom segment and rotating it the opposite direction, in this case to the left, I'm actually causing right AO rotation and left AA rotation. You might want to pause the video and get out a model just to review this, because it'll make sense once you look at it a couple times. So I'm in this situation. So if I take C1 and rotate it to the left, and it increases the pain, that's left rotation at the AO joint, so the AO joint is implicated. If it decreases pain, then we know it's the AA joint. To confirm, what we can do is have the patient take them out of that position. Don't keep them in that position for a long period of time. Rotate them again, and this time, instead of rotating them to the left, we rotate them gently to the right. And we're talking gentle. In a lot of my classes, you take up the soft tissue slack I mentioned, so you can get on the bone, and then you can do it. So you're not twisting it really hard, you're just gently nudging it. So this time the AA joint, when you're going to the right, would be increasing right rotation, and if it's painful, it would be the AA joint, and if the pain decreases, it's the AO joint. Let's say both are sensitive. Well, it could be both joints, or it could be the fact that you have sensitivity at the C1. So you can always just take C1 and do a little bit of a lumbrical grip to see if that increases the pain. If that's the case, we may have to put the patient in a collar to get rid of some of that C1 hypersensitivity. The last part, when we're looking at the right rotation that increases the retroocular eye pain, is looking at some tissue differentiation. So you have rotation to the right that causes some of the increased retroocular pain. What we can do is actually resist some right rotation. So I gently do it, so I can use my thumbs and I can say, okay, can you gently turn your head? Good. That's an isometric contraction, and it can be an isometric contraction of either the left inferior oblique or right superior oblique. That's what produces those. So you can use palpation, and we'll look at the anatomy videos to differentiate between the two. There's also a couple other forces at work. So you can have them rotate and just do some gentle compression to the area, because they might have some sensitivity transarticularly. So again, if that's the case, you may want to immobilize the patient to get rid of some of that sensitivity, coming back to this test to see if it decreases after time. And in my case, a few patients that have had acute necks, a lot of them were construction workers that hit their head on something and caused some kind of compression injury. Using the collar for a week actually really helps decrease their pain. And it was just a soft collar, teaching the patient the concept that if they rested their chin on the collar, it would take away some of that discomfort. You can also have them in this position and add some gentle traction to the area. If that decreases the pain, again, there could be some irritation in the osseous segments, in the bones. If it increases, then you know the ligaments are sensitive. And again, that might implicate the use for a collar. So all three portions of this, the differentiation between OA or AO, AA, C2-3, and the tissue differentiation will help you if you have somebody coming in with a more acute trigeminal symptoms or symptoms indicating the top three joints are irritated.